I came to see Dr. Demand because I had chronic knee problems, which was diagnosed as arthritis, and I just couldn't walk, I couldn't move, I couldn't function anymore. The first treatment I had was a stem cell replacement, and then recently I just had a PRP treatment. Oh, it changed my life, and I'm back to being me. I've lost almost all my weight, I can run around with my kids. I'm a completely different person.
I've been with Manhattan Medicine for, I think it's close to 10 years now. I can tell you about my most recent experience. I had sort of a weightlifting injury at the gym, or a bar crashed down on my shoulder, and I had a tremendous amount of pain in my upper torso, just shooting pain. I just left it alone for a couple days thinking it would go away, but it got worse. I saw Dr. Rothman and Sanjay, and they did some manual therapy on me. It made me feel a lot better so I could manage the pain. And then I saw Dr. Okoronkwo, who was actually able to diagnose exactly what was going on. She discussed different sorts of therapies that I could use. We decided to go with the more conservative course of treatment. And basically within I guess a few days, it felt so much better. I mean, it was well enough that I could go back to the gym, resume my normal activities, and it was just great. I think it really exemplifies the type of treatment I get here and why I love this place.
What I originally came to Manhattan Medicine for was I had pretty much damaged both my ankles through excessive snowboarding. I did try other therapies, and then standard physical therapy. When I looked at the MRI, I was like, there's no way physical therapy is going to fix this. I didn't know what was the right thing to do. Should I do stem cells? Should I do PRP? Should I do reconstructive surgery? And I got an opinion from somebody from the hospital, from special surgery, a really good doctor. Came here, told Dr. Demand, and he was like, you know, it's not how I would do it, but it's still a solid treatment. And this guy, I've heard of him, he's pretty good. You know, you could go either way. But in some ways, that built confidence to me that he wasn't trying to just push me into something just for the sake of doing it. As far as how the treatments are going, the left ankle, I got lucky. 2 PRP treatments, which stands for platelet-rich plasma. The treatment was extremely successful. It's still regenerating, but it's like 95% there. On the right one, it was much more damaged. And Dr. Demand has been pretty honest and saying that he is really happy that my ankle is progressing so well because he didn't know if such a damaged ankle would be healed so much. The stem cells definitely started the healing regenerative process, right? But the ankle's still not 100%. For me, I want 110%. And so we've done things to enhance the stem cell growth. This ankle is healing just at a slower rate, and I feel very confident that it's going to get to 110%.
Originally, I came to Manhattan Medicine because I had a knee injury. Before coming to Manhattan Medicine, I feel like I've tried everything. I went to physical therapy, some mobility work, I mean, which helped. I did do some acupuncture, but nothing was, I mean, I had an actual hole in my meniscus, and then it caused a tear in my MCL, and then it turned into a little minor strain in my calf. It was just one thing after another. So I know I needed something big. In the office, I had PRP to fix my torn meniscus, MCL. I actually also had PRP on my scalp. I think it was either hormone imbalance, probably stress. And it was so incredible to see within a couple of months, 2 to 3 months, areas that I had significant thinning filled in. PRP actually changed my life significantly. After the original treatment, within 5 weeks, my knee was pretty much healed, and I had to slowly get back into my normal routine of everyday exercise. But I remember waking up going, oh my gosh, the PRP treatments changed my life dramatically.
I went to a friend of mine who's an orthopedic surgeon because I was in so much pain in my lower back that I was afraid I wasn't going to be able to pick up my daughter who was expected in a couple of months, and he sent me here in lieu of doing surgery. And I started traction, chiropractic, some physical therapy, and stuck around. I had been to probably 10 other chiropractors. I'd been suffering from it on and off for about 20 years, most of my adult life. And I was just sort of at the end of my rope, and came here, and it was almost a whole different treatment modality that really excited me, the way they treated the whole person here. My neck was in a lot of pain a few years later after I had a shoulder injury, and I came for chiropractic, physical therapy, and eventually tried stem cell PRP treatment, which finally relieved the pain. Suddenly, after I got the PRP booster at about 4 weeks, 2 weeks later, I woke up one morning and I had forgotten what it was like to not be in pain. And I said to myself, wow, being relieved of constant pain allowed me to stop going on and off prescription painkillers, which are bad news. And I was able to return to a sport that I love, which is CrossFit. And I'm stronger now at 47 than I was at 25.
I had just gotten a new job, and I tweaked my neck somehow on the subway, and I was just looking for a chiropractor. My friend recommended your office, and I came in and found out many other things that they do here. So when I first came in, I talked to Dr. DeMann, and I had injured my knee, and he suggested that we do stem cell therapy. The first one that we did bone marrow. After about a year, we were finding that that wasn't working that well, so we did stem cells from fat mixed with the PRP, and since then I haven't had any pain, and I have full function. Well, I also had it done on my shoulder last year, and I have full range of motion now. I had 3 tears in my supraspinatus muscle, and he also did the stem cells from fat in there, and then following any of these therapies, I've had chiropractic, physical therapy, and acupuncture. I started teaching Pilates recently, and I think without both of those treatments, it would be a whole lot more difficult to be doing that.
Since about 2009, I had a partial lateral release and microfracture surgery done on my knee related to sports injury. I did the stem cell therapy. The immediate day after, there was some swelling and resting, and probably took about 3 or 4 days to get back on my feet, but the full recovery was really off of it and not doing any exercise for about 2 months. Prior to the treatment, I felt like I had to ice my knee every day, if not once, twice a day. And I generally have some swelling, discomfort, and pain in the area. Post the procedure, I feel as though I don't have to do that anymore. So I'm not really icing much at all, don't have the swelling. I kind of have more day-to-day function and comfort, which has been really great.